Today we're discussing endometriosis and the risks for the management of it. So, what is endometriosis? It's a female condition where the lining of the uterus grows outside of the uterus, often causing the woman a variety of signs and symptoms. It affects more than 11% of American women between the ages of 15 and 44. The most prevalent symptom of endometriosis is pain. Women often complain of pain during their menstrual cycles, sexual intercourse, and during bowel movements. Along with pain, women are often infertile or having a hard time becoming pregnant. When the woman sees a physician about having a hard time becoming pregnant, it is often when the woman finds out that she has endometriosis. To manage endometriosis, there are a variety of treatment methods available depending on the woman's prospective choices of family planning. The methods of treatment include oral contraceptives, gonadotropin releasing hormone agonists, surgery to remove the adhesions and scar tissue present from the endometriosis, and hysterectomy. The treatments chosen for the patient are often dependent on how many endometrial lesions or scars are present and if the woman would like to become pregnant or not. In today's fast paced world, women are often being pushed harder than before to prove themselves to today's society. With these added pushes come added stressors. It's also a time for women to delay their potential family planning to later in life in comparison with women from the 1950s and 60s. With these added stressors come added problems. Women are often eating on the go, under intense stress for long periods of time, and delaying parenthood until their later 30s and even in their 40s. With the women of today having higher levels of LDL, hypertension, maturing into her 30s and 40s, and smoking, puts the woman at an increased risk when deciding the route to take to treat her symptoms of endometriosis. With an aging woman having so many hurdles to jump, she may be in the category of being over the age of 35, hypertensive, or smoking, and have no treatment options for endometriosis other than surgery because oral contraceptives are contraindicated for these women. Since a hypertensive woman over the age of 35 would be contraindicated for the oral contraceptives, she is often led to surgical options. The most prevalent surgical option is a hysterectomy. A woman that wishes to carry a child would then have to undergo surgery to have her uterus completely removed and take weeks off of work to recover emotionally and physically from the pain of surgery. According to Beller and McCartney, there should be more options available to women with conditions such as hypertension to provide a woman relief from endometriosis. In doing so, we're able to give the woman more options other than having a hysterectomy. Along with the options, we should also discuss the risks because, like everything, there are risks involved. But using a tool like the Framingham Risk Calculator will allow the provider to calculate the individual woman's potential cardiovascular risk to taking oral contraceptives. If a patient is in an otherwise healthy state but is 35 years of age and has her hypertension under control, then according to the Framingham Risk Calculator, she may become eligible to use combined oral contraceptives to treat her endometrial pain as the first line of treatment instead of surgery. Having a woman's comorbidities under control, such as hypertension or hyperlipidemia, should allow a woman to have more options in controlling her endometriosis and future potential family planning. Now more than ever, women are delaying motherhood to later in life, and research and opening up options for helping a woman deal with her endometriosis is still stuck in decades past. Since there have been so many cases where women have developed deep vein thromboses and myocardial infarctions following oral contraceptives used with a hypertensive woman or a smoking woman, the use of those contraceptives stopped there. But there are many women that may smoke one cigarette a week that could be eligible to take oral contraceptives. Or there could be a woman that has very well controlled hypertension and could be put on a low dose contraceptive to help with her pain. The use of cardiovascular risk screenings can provide the woman with the knowledge of her cardiovascular risk and the choice to try an oral contraceptive or not. Women should be presented with the case of their health and given the choice to make their own decisions regarding their health. The woman with hypertension that is well controlled may possibly want to take a low dose contraceptive and be just fine with the outcome. A woman may be given her risks and shown what could potentially occur if she did take the oral contraceptive and not take the oral contraceptive. If the outcome is not favorable or too risky for the woman, then she can decide against it and move on to another route of treatment. The concrete decisions made in healthcare without the use of cardiovascular risk assessment tools cuts off many modes of treatment for the woman with endometriosis. By allowing the woman to make the decisions on her treatment options and providing all of the risks associated with the treatments, we are allowing the woman to have control over her body once again. For more information on endometriosis and the treatment of it, there are some great resources. The American College of Obstetricians and Gynecologists, the Centers for Disease Control and Prevention, and the National Women's Health Network are all great resources for women for their women's health needs.